I think especially as Aboriginal artists, our truth is what makes us who we are in our culture and our spirituality. And that truth resonates into the community.
Mob or Jarjum, that's tomorrow's children, because all we do is for them, really. And if they can get these words, get the pronunciation of it correct, they can then start using it in daily life, and they do.
It's relationships between mothers and fathers, between parents and children, between children and their grandparents. It's that deterioration of that family relationship and connection.
Aboriginal and Torres Strait Islander people can now stand with huge humility and be very proud of who we are and what we are, and the way in which we have survived.
Hi everyone, I'm Mandanara Baz and welcome to Beyond the Boundary Road.
And I'm Fred Leone. Today we have a very important show for you as we will be talking about women's health. We're joined on the show by Jodie Dyer, who's here to talk about Narrama Health Service.
Thank you, Jodie. How are you?
Thank you for having me both here today.
No worries.
So Jodie, tell us, who's your mob? Where did you grow up?
I come from Victoria, from a place called Sunshine in Melbourne, and my mob is from around the Ballarat area.
Yeah, cool. So tell us a bit about Narrama. We know that it gained a lot of support from the Indigenous elders within the community in the development of the program and also the naming of the program. How critical has that been a critical part in the success of this program, do you think?
Yeah, it has been a great success with conversing with the elders, talking to the elders on a regular basis. They had a lot of input when it came to Narrama, especially the naming of Narrama. They also seen the need for Narrama in the community.
How does the name Narrama actually relate to your role?
Narrama means guardian birth spirit, and what Narrama offers, we hope that we offer with myself and the midwife, being a guardian birth spirit.
Oh, it's deadly, isn't it?
Yeah, that is deadly. Hey, what did Narrama identify as some of the obstacles that some Indigenous women were facing when they were going in to have birth?
Some of the obstacles that women would face would be some women would only present to hospital when they were ready to give birth. Other women wouldn't maybe have 1 or 2 antenatal appointments, and also the identification of Aboriginal and Torres Strait Islander women.
So Jodie, Narrama has only been around for a few years. Could you tell us about the service and the home visits, which I know are a crucial part of the program?
Yes, Narrama, we start from antenatal and we do home antenatal visits with our mums that have a pretty straightforward pregnancy. Then we have our postnatal visits where the midwife will come in and visit mum after she's had baby, and also the child health team where the child health nurse and the health worker will come in and visit mum and baby.
What age group do they go up to?
From 0 till 2 years old.
Okay,
They'll follow right through, but at any time if the mum chooses to disengage, it's her choice that she can disengage in the service.
Yeah.
Just needs to get out there, doesn't it, Freddie?
Yeah. Why is it important for women to attend at least 5 antenatal consultations before they give birth?
We like our women to have at least 5 antenatal appointments, due to the fact that we're all about early intervention, and also with the importance of education, because with being Aboriginal Torres Strait Islander, with the chronic health diseases, the extra immunisations, we like all our women to have that sort of education. Also, when it comes to birth weights, education on smoking, breastfeeding, safe sleeping, all that sort of stuff. And sometimes women might have complications through pregnancy that they don't know about, like diabetes and that sort of stuff. So we like our women to engage so they can have all that education.
Better picking up something, in the early stages so you can treat it rather than having something stick around and not being able to do anything about. That's deadly, Freddie. So can mums that are not Aboriginal use Narrama?
Yes, they can. We have probably 50% of our mums are non-Indigenous because Dad identifies, and that's what's good about Narrama. It's for either parent who identifies, they can, tap.
As long as that child obviously has Aboriginal or Torres Strait Islander bloodlines.
Yeah.
That's very good.
Yeah, that's awesome. Hey, can you tell us a bit about partnerships or collaborations that Narrama has with other community organisations or services around the community?
Yeah, we have a few of them. We work closely with our community health services that are around us in community, with Morton Aches, also Magellan Medical Centre. We work very closely with them. They promote Narrama and they refer all their mums that are pregnant. They come to...
Whereabouts is that, Magellan?
Magellan is in Scarborough.
Okay,
And also Morton Aches, Caboolture, Strathpine, Deception Bay and Woolloongabba.
Where do you see Narrama heading in the future?
Hopefully for big and better things, and maybe one day having our own birthing centre where women can come and birth in a setting like this.
It's deadly, isn't it?
Yeah.
To know that one birthing centre could maybe snowball into different communities over different states across this country.
Yes, and that's what we hope to do. We hope Narrama, has that ripple effect, especially in community.
It's definitely a great need for our people, regardless of it being in Queensland or all over. We need to get these birth centres out there.
Look, I have a lot of family down in Victoria and I tell them all the time about Narrama and that they should start something like Narrama up down there all the time.
Yeah. Have you got any stories that you could tell us about or feedback that you've got from mothers that have come through Narrama that really push you, like drive, inspire you to go, gee, I'm so glad we started this, I'm so glad it's here, I'm so glad it's a...
I have a lot of mums say to me, it was so good to have your support, to have the same midwife right through the pregnancy. It was so good to not have to retell my story. I didn't feel judged. I was culturally supported, spiritually supported and emotionally supported. And I was linked into other services.
That's just great, Freddie.
Yeah, that is.
We're meant to be having more positive stories when it comes to accessing mainstream services with a Murray touch.
Yeah,
because with Narrama also, we have a seamless, once mums give birth, we then refer them to Narrama Child Health where they'll get looked after in community from 0 to 2 years old. So it's like a seamless ripple effect.
Yeah.
And that's probably the main thing, is to stay connected so they know that you're there from after the baby, not just while they're pregnant.
Yeah. Highlights. What's been your highlight in the job so far? How long have you been there and what's your highlight?
I've been in my job role now for about 17 to 18 months. My highlight would have to be watching a mother give birth. It's just the most amazing thing ever, and also being part of a woman's journey, walking beside her is a privilege when she is pregnant. And watching her go from a little belly to a big belly out here, it's just one of the most amazing things that I can be a part of that. And hopefully make a little bit of a difference, that the mum has a wonderful journey and experience.
Also, that makes so much more of an impact on that newborn baby when they've got a happy mother.
Yes,
who's been supported and had a beautiful birth.
That's so true.
Taking the baby home and actually being in that beautiful kind of spirit.
That's so true, because they say that when babies are in the womb that they can hear and they run off mum's emotions. So if you have a less stressed mum, you're going to have a less stressed birth and a less stressed baby, and it's going to be better for mum when she goes home, especially if she's a first time mum or if she has a couple of kids. It makes a difference and it gives that baby a little chance.
So for Aboriginal and Torres Strait Islander women and non-Aboriginal Torres Strait Islander women who have a Murray or TI child, how would they engage with Narrama? How would they be able to find you guys?
They can speak to their local GP, speak to their Aboriginal Torres Strait Islander Medical Centre and ask them to do a antenatal referral through to Narrama. Just put attention Narrama on it. That's how they can find us, and hopefully the doctor service would have our brochures in their clinics, because we make sure that we have our brochures in most of the Aboriginal and Torres Strait Islander health clinics.
Excellent.
Yeah, great.
So thank you very much, Jody, for coming in and talking to us and sharing the deadly success that you're having at Narrama.
Yeah, thank you for coming on the show.
And thank you for having me.
No worries.